and good afternoon. It is our regular Lunch and Learn, and I'm really excited to talk to you today about red light therapy. Now, there's all kinds of red light out there. There's red light, and there's near infrared light, and there's far infrared light. And so we're going to be talking about the first two today. We are bringing red light therapy into the clinic, so I'm really excited about that. And so when we do our research and we're trying to make decisions, and then all of a sudden we get an article that comes across the desk that just confirms what we're doing, it's like, oh yay, we're on the right track. And so I'm really excited about this. So red light therapy does a lot of different things. And so we're going to talk a little bit about it. I'm going to tell you a little bit about what we're bringing into the clinic because I'm so excited about this, and it just gives us a lot of new things to offer you. That's not just take another pill or take another tincture or something like that, and it makes you feel really good too, so we're excited. So the article is entitled The Benefits of Red and Near Infrared Light Therapy. Like I said, we're going to talk about far infrared on another day, but red light and near infrared light are subsets of natural sunlight. So when you're out in the sun, when you're doing what you need to be doing out in the sun, you automatically get these frequencies. Remember, light is frequency. Health is frequency. When we are unwell, it is because we lack the frequencies that we need for health. If we're in optimal health, that means we're getting all the frequencies that we need. And so this is why we work with light. This is why we work with supplements. This is why we work with plant therapy, because anything that is alive has a positive, beneficial frequency. Things that are manufactured in a laboratory also can have a frequency, but it's usually a debilitating frequency. It's not a living frequency. And so we want to nourish our cells. And there's a great graphic that I have seen. I've seen it multiple times, and it talks about the voltage of a cell. So if you look on Google, you'll be able to find it's a cell voltage, and it tells you what voltage a cell needs to have so that it can be healthy inside your body. So light, sunlight, is very health giving. Red light and near infrared light therapies are two ways to get some of these benefits. It may be particularly valuable and beneficial for people who are not getting enough natural sunlight, and that is the majority of people in the world today. I have a friend who wrote that she needed the sun. She wrote this on her Facebook page yesterday. She needs the sun. She just feels so much better when she's out in the sun. Did anybody else agree with her? And it was like, yes, I do. I love being out in the sun. And of course, we're told not to get in the sun, and that might not be the best advice, okay? So despite, the article goes on to say, despite all those things, which is the negativity about sunlight being harmful to you, it is also the case when you compare people with regular sun exposure to people with much less sun exposure, they do not have higher incidence of melanoma. And that's what we're told. We're told to stay out of the sun so that we don't have skin cancer. The studies, if you read the studies, if you follow the science, it says that the people that are out in the sun a lot, now we're not talking about when I was a little girl, we lived on the lake, and I would go out in the summer and I'd lather up with baby oil, right, or coconut oil or cocoa oil, and lay there and just not get burnt to a crisp, but I would definitely get really red, but I would turn dark. I'm not talking about that. I'm talking about going out and sitting on your patio in the sun, not necessarily between noon and 2 if you live in South Texas the way we do, but early morning. I often will go out early morning before 10 o'clock and just, enjoy the sunshine because it's just good for you. A lot of times I'll go out after work as well, enjoy the sunshine. Because why? Because it is good for you. There's a bunch of studies, it says, comparing outdoor workers to indoor workers, showing that outdoor workers have lower rates of melanoma despite 3 to 9 times more sun exposure. Okay, so sunshine is good. We need sunshine. We don't want to be baking ourselves, and if our skin is telling us, I'm getting a little crispy here, then we want to go in. We don't want to be staying out there and getting super crispy, okay? But you do want to have good sunshine. So the absence of that exposure to sunlight creates abnormal cellular function. I want to read that again. The absence of sunshine in our day gives us abnormal cellular function. One of the reasons for this is because indoor workers are exposed to fluorescent lighting, which is loaded with dirty electricity, high voltage transients that have a biophysical and psychological negative effect on people, okay? So, as you can see, I've got a little halo because we've got lights. I don't have fluorescent lights in my office, but it's not natural light. I wish I could have natural light in my office, but the way the building is configured, that just wasn't possible. So I need to get out in the sunshine. You need to get out in the sunshine, especially if you're in an office with fluorescent lights, because it's just dirty lighting and you're missing the good benefits of direct sunlight. The article goes on to say, in the span of a few generations, people have lost the essential nourishment of the sun and have had their environments saturated with microwave emitting wireless devices, and we know that that is true. So not only do people not get sunlight exposure, but they get quite a bit of harmful EMF. Now, EMF stands for electromagnetic frequencies. We were not built for electromagnetic frequencies, even though we love the convenience of our phone and our tablet and all that kind of stuff. We were not wired for that, and so it is having a negative effect on our bodies. So the side effect of this change is that people have lost their normal biochemical reactions to the sun. Intermittent exposure to sunlight, followed by many days or weeks of little to no exposure, tends to be more problematic than regular, frequent sun exposure. So you're more likely to harm your DNA because of the dirty light, the dirty electricity, okay? Regular exposure, on the other hand, ameliorates this risk. It engages innate adaptive systems in the skin, your melanin in particular, that are explicitly designed to prevent DNA damage from UV light, ultraviolet light, okay, exposure. When you go outside and you put your SPF on, and I put SPF on every day, especially on my face. Why? Because I'm getting older and I don't want to have the wrinkles and that kind of thing. But on my body, I don't put SPF on there. I'm not out there long enough to get any kind of sunburn. Like I say, I'm out there maybe an hour, maybe not quite an hour, but I try and do that fairly regularly so that my body has a chance to do what it needs to do with the sunshine and the vitamin D and all that kind of stuff. So, just as we require adequate nutrients from the food we eat, just as our bodies require physical movement to express normal cell function, we also require adequate light exposure to express normal cell function. So have you ever thought of light as a nutrient? I mean, that's kind of a new wrinkle, right? Light is a nutrient. And I think that's really interesting because one of the things that God said was, let there be light. So light is really, really important to us. It's important for our wellness. It's important for our cell metabolism the way it needs to. And I think the article talks about mitochondria function as we get on down into a little bit of that. The absence of exposure to sunlight creates abnormal cell function, and there are myriad of mechanisms through which this occurs. Now, what is abnormal cell function? Well, abnormal cell function is sickness and disease. The ultimate abnormal cell function is cancer. So, bear in mind that in order not to have skin cancer, you need to have an adequate amount of sunshine. Not getting burnt, not getting sunburn, but being out there in the light. Vitamin D is obviously the most well-known benefit of sunshine. It regulates over 2,000 gene expressions related to your immunity. Now, I have been looking at statistics, and the statistics are showing that if you have an adequate amount of vitamin D, you're not going to be prone to viruses, you're not going to be prone to depression, and you're not going to be prone to cancer. So this is a really, really good thing. On your medical reference, the medical profession wants your vitamin D to be over 30 nanograms per deciliter. Holistically, we want that number to be over 60, and the sweet spot is around 80. So if you are showing deficient on your blood work, below 30, you're really, really deficient. If you are between 30 and 60, you may think you're okay, but really for the immune function, you're not all that great, okay? And you want to make sure that you supplement with vitamin D. Now, I just want to throw in a little information here. Vitamin D uptake is through your blood supply. If you take vitamin D as a supplement, that is a pill or as a gel cap, it's going to go through digestion, get chewed up in digestion. It's going to go through the liver, the first pass of the liver. It's going to get chewed up there. Then the blood's going to take it to the kidneys, where the body's going to be able to absorb it. So you're going to have minuscule amount of whatever you're taking orally. We have a, I can't remember the word, liposome spray that you spray right into your cheek, and we've seen that it doubles your levels within 60 days. There's no waste. It goes right into the mucous membrane, right into the bloodstream, right there. So what does that mean? It means it passes your digestion, and it passes your liver too. There's zero waste. Okay, zero waste. We don't like taking supplements that we just pee away. We don't like taking supplements that we're not able to absorb. That's why a liposomal supplement is something that your body knows where it goes, and it's no waste in there. So that's just really, really important there, okay? One mechanism, sunlight. We're talking about sunlight. And this is, let me just back up a little bit. We're bringing red light into the clinic, and it's going to go in through the eyes, and you're going to keep your eyes closed, right? It's going to go in through your eyelids, and it's going to go in through your ears. Why is that? Because red light frequency is very, very healing, and it goes right into the brain, which is where we're missing some connections sometimes. You know, we want everything to be perfect. We want everything to go the way we want it to go, and that's just not how life is in the real world. So we get depressed, we get frustrated, we get all these other kinds of things that we get, right? And so this red light therapy is going to help connect the brain to the different areas of the body. So we're really, really excited about that, all right? So one mechanism by which this red light works is through your eyes, which is why you're typically better off not wearing sunglasses on a regular basis. Let me just pause here. I used to be very, very photosensitive. When I would go out in the sunshine, my eyes would hurt. I couldn't look at the sun. I couldn't even be outside on a cloudy day because my eyes just hurt. Well, when I started studying natural health, I found out that that is a vitamin A deficiency. Well, that's an easy thing to fix, right? So I upped my vitamin A, and guess what? I rarely wear sunglasses now. I mean, I just rarely wear them. I go out, I drive. I really only wore them when we would go out in the boat, because you've got the reflection from the water, which gives you more intensity, right? So I can go outside now in bright, bright sunlight, and I don't need to wear my glasses. Now, depending on the intensity of the sun, if I am squinting and all that kind of thing because I don't want to have wrinkles, I might put on my sunglasses because it's just so bright. But most of the time, I don't wear my sunglasses outside. So if you are photosensitive, it is because you have a vitamin A deficiency. Be careful. A lot of vitamin A is synthetic. It does build up in your tissues. You can get vitamin A poisoning. So make sure that you get your vitamin A from a really good plant-based source. All right. Let me see where I was. Okay. When you're outside on a sunny day without sunglasses, blue and green wavelengths enter your eyeballs and feed through the nerves into the circadian clock in your brain. Now, the circadian clock is what causes you to wake up, what causes you to sleep, what causes your body to function the way it needs to. It regulates a variety of bodily systems, from neurotransmitters involved in mood regulation to hormones involved in immune function. A dysregulated circadian rhythm has been linked to dozens of diseases, including cancer, cardiovascular disease, and neurological diseases, okay, so brain diseases. So we know, you may not know that, but right here in the top of your brain, you've got a little bitty gland. I mean, it's tiny, tiny, and they call it the pineal gland. Why do they call it that? Because it's shaped like a pine cone, all right? It is connected to your optic nerve through your eye. It needs sunlight to function. So when you're outside in the bright sunlight, not bright enough to squint, but in the daylight sunlight, the red and blue and green, whatever colors are in the spectrum, go in through your optic nerve into the pineal gland and cause that gland to work properly. Now that pineal gland is, some people call it your third eye, some people call it your spiritual gland. That's the way that you connect to God. I know we connect to God through the Holy Spirit, but I do know that the pineal gland also helps with your creativity. It helps with you being able to think outside the box. It helps you to connect on a spiritual level. So when you're not having adequate sunlight, you may be having some problems with that as well. Let me see what else I wanted to say here. Okay, over the past few decades, more than 5,000 studies have been published about red and near infrared light therapy, aka photobiomodulation. How do you like that? Photobiomodulation. That means working with your bodily systems with light for a wide range of ailments, from combating wrinkles and cellulite to hair regrowth, sports performance, accelerated injury recovery, increased strength, and more. You get improvements in strength adaptation, improvement in muscle protein synthesis and the amount of muscle that is gained, and amplified weight loss, increasing insulin sensitivity, all when combined with exercise compared to doing exercise alone. So, along with red light therapy, we're also bringing far, not near, far infrared. And why are we doing this? Because far infrared technology will help with weight loss, it helps with inflammation, it helps with pain, it helps with just tons of different things. So red light, in whatever variety it comes in, is very, very healing. It's very, very beneficial. So we're excited to bring these therapies into the clinic. So I hope you're excited too, all right? The article goes on to say, there are at least dozens, if not hundreds, of studies using red light therapy in the context of people undergoing chemotherapy to combat oral mucositis. This is inflammation of the mucosa in the mouth. This is a side effect that happens with chemotherapy drugs. One of the most, if not most, effective treatment for this is red light therapy. Who knew, right? Who knew we could do that? It says red light therapy modulates gene expression. Now, I love this. Why do I love this? Because a lot of people come in and they will say, I've got this disease, that disease, the other disease in my family tree, right? And that may be a thing. But it's the way you live, what you think, what you eat, all the drama in your life that causes those genes, those negative genes, to switch on, right? So I could, and I know my DNA, I did my DNA testing, so I know the problems that are in my family line, but I'm not worried about it. Why? Because I live right, I think right, I eat right, and I'm not expressing those negative genes to turn on. I'm expecting my positive genes to stay switched on, all right? And that particular science is called epigenetics. You've got genetics, what you're born with, and then you have epigenetics, which is how you live your life. If you have a bad life, if you have a trauma life, if you have no peace in your life, if you don't eat well, if you don't eat healthily, then you're going to turn on some of those negative switches that are already in there. You don't want to do that. You want to be healthy. Okay, it says another mechanism, or third mechanism of action, involves the retrograde signaling and modulation of gene expression. Your mitochondria play a role here as well, as explained by Witten. Now, Witten is a doctor here. Mitochondria are not just mindless energy generators. Now, we were taught in 4th grade health that your mitochondria is the powerhouse of your cell, and it is, but it's so much more than that. They also are environmental sensors that pick up on what's going on in the environment. Are there toxins present? Is there a pathogen present? Is there increased inflammatory cell present? Okay, they're picking up these signals. They're also picking up on light signals, the reactive oxygen species from hormetic stress, right? That's a lot of big words, but that goes back to the epigenetics that I was talking about there. There is a specific set of genes that are expressed in response to red and near infrared light therapy. In summary, it activates the genes involved in cell repair, cell regeneration, cellular growth, depending on the tissue. So who doesn't want cellular regeneration, right? Who doesn't want cellular growth? We all want that. We all are, especially if you're a girl, you're looking for the fountain of youth, right? Because we all want to stay pretty as long as we can. So this red light therapy helps to regulate the mitochondria to increase the cellular expression, cellular growth, cellular repair, and cellular regeneration. That's what I love about this. And so I'm really, really excited to be bringing these other therapies in because most of us don't get outside. I remember, I haven't seen Renee come on, but I used to work with Renee years and years ago. And when it was a nice day, she would tell everybody, go outside, eat your lunch outside because light is so important. And she's so right. And so if you have a chance, while it's not 150 degrees outside in South Texas, you want to go out and have your lunch, have a walk, and make sure you get some of those beneficial rays, okay? The other thing, and I want to end on this, the other thing, exposure to UVA, red light, and near infrared light also increases the release of nitric oxide, which, while being a free radical, also has many metabolic benefits in optimal concentrations. Many of the benefits of sun exposure can't be explained through the solely through the production of vitamin D, okay? It's the release of nitric oxide may be part of the answer. Now, if you're a bodybuilder, you know that nitric oxide pushes more oxygen into the blood, which makes your workout better, makes your recovery better, okay? And nitric oxide relaxes your vessels, your blood vessels, so that your blood pressure stays low, right? Also, nitric oxide is good for sexual function, both with men and females. I bet you didn't know that. So if you go out in the sunshine and you have enough of this ultraviolet light, which of course is what, the sun gives us, the red light spectrum and the near infrared spectrum, that is all going to work. Besides working on your mitochondria, besides working on your immune system, besides doing cellular regeneration, it's also going to help you achieve peak sexual performance. And who doesn't like that? I know people don't usually talk about this, but wouldn't it be better, instead of taking Viagra, right, to be able to take sunshine, get your body doing what your body needs to be doing so that you can operate in a more healthy way, which I think is just a great idea, okay? So we are, as I said, we're bringing this into the clinic. I'm excited about that because I think that if we have other therapies to go along with our nutritional therapy, that's a great thing. Some people are asking me about quercetin, okay? They're reading a lot about quercetin and how important it is, and I have a paper. Let me see if I can put my hand right on it, and I just dropped the whole thing, so I apologize. These foods are loaded with quercetin, all right, and this is in the way they came up on my research. Red wine, black tea, green tea, okay? Onions, so if you like onions, you're getting a lot of quercetin. If you like kale, a lot of people don't like kale, but if you like kale, it has quercetin in it. So do cherry tomatoes. In fact, all tomatoes, but cherry tomatoes are the best because they have the highest ratio skin to flesh, okay? Broccoli. Broccoli has a lot of quercetin in it. It also has a lot of vitamin K and vitamin C. You need vitamin K to metabolize the vitamin D that you're getting from the sunshine. So this works well with that. Your onions, as we said earlier, have a lot of biotin in it. And so remember we talked about red light helping regrow hair, right? Biotin, what is biotin good for? Biotin is good for the hair. Where are you getting this? You're getting this in your onions. Also, blueberries. Blueberries have a lot of quercetin in it, and so do apples. Now, in order to get the benefit from the apples, you need to make sure that you're eating the apples with the peeling on. And guess what I had for a snack this morning right before we started this program? I had apples with skin, right? Why do I do that? Because that's where all the nutrients are, is in the skin. So, if you have any questions regarding red light, reach out to us. We're going to make a big announcement when our tools come in. They are on order. They should be here in the next day or two, and so I can't wait to share that with you. So excited to bring to you the science behind red light therapy. So, you know, it's more than just anti-aging, although it is that. It does work on your immune system. And so if you're worried about your immune system, if you're concerned about your immune system, we've got a lot of help for you here, and we're excited to share that with you. So it's the weekend. Have a great weekend. Take care of yourself. Do a lot of self-care. Thank you for tuning in. Thank you for sharing. Thank you for commenting. I appreciate it. I heard from a lady in Saudi Arabia this week, and she says she watches all the time, so I appreciate that. I never knew that because she doesn't comment. So it really helps me to know if you comment or just send me a private message that I'm here, I'm there. I know we've got people in India. We've got people in Pakistan. Now we have people in Saudi Arabia. I know I have friends in England that watch, and they never comment, so you might not know that. But thank you for sharing. Thank you for watching. Enjoy your weekend. I'll see you next week.